All right, can we go? Can we start? You want to behave so we can actually do this, Anton?
No, I should be like misbehaving.
We are not shaming people who get COVID, Anton.
Definitely not. We're just shaming Marco.
Are we ready?
Is This Going to Kill Me? A health podcast with Howard Feldman and Dr. Anton Meyberg.
A very good day to you. I'm Howard Feldman, and this is the very first episode of Is This Going to Kill Me? With me, Howard Feldman, and of course, Dr. Anton Meyberg. How does it feel to be back in studio, Ant?
Feels very relaxed compared to the last few times we've been here.
Yeah, well, we're not in PPE or something, what?
No masks, no PPE.
Nothing. And here we are. I'm just looking at an article. Coffee quitters could get some help. Decaf dose may help reduce withdrawal symptoms. Did you know this?
I've heard about it.
Yeah.
I mean, we all hear that, when you're going to go off the route.
Caffeine.
You've got to go off the caffeine diet. You've got to go completely total off the turkey diet. So basically you've got no caffeine at all. That's what most people say.
But is caffeine actually bad for you?
So in life, things are bad for you, but things in moderation aren't bad for you, certain things. So, for instance, if you're asthmatic, caffeine's got something called methylxanthine in it, which actually is a bronchodilator, which opens up your lungs. So in that respect, caffeine is very good for you.
Okay.
Caffeine's a stimulant. It can cause your blood vessels to vasoconstrict. It can push your heart rate up. It can push your blood pressure up. From that point of view, it's not great for you. But it also wakes you up and gives you energy and keeps you aroused. So in that respect, it's very good for you.
How many cups of coffee a day is reasonable?
Reasonable, 2 to 3 cups of coffee, not more than that.
2 to 3?
2 to 3. Yeah.
I'm getting somebody else on these podcasts.
I haven't said between which times.
But I was just going to say as well, define a cup of coffee. How many shots?
So we're not talking about a 2-finger tot or a 2-finger tot. We're talking about a normal cup of coffee.
2 to 3 cups of
2 to
coffee
3 cups
a day?
of coffee a day, yeah.
I only have 2, so I'm quite lucky that way.
And in the afternoon?
Another 2 at least. All right. Okay. Let's just talk about medical. No, let's not do that. Let's start with COVID.
Okay, can we get under the belt and get away with it?
Yeah, let's just get rid of COVID. We'd all love to get rid of COVID.
We hate COVID.
I actually think I had COVID last week, by the way.
Yeah.
In fact, I'm convinced I did. I did a test.
And did you survive?
The test, yes.
Yeah. And why did you survive? Is it maybe because of the fact that you might be vaccinated?
Well, it could be. I had some
ivermectin
at home in the bottom drawer. No, so seriously, where are we with COVID? Because I am hearing of people getting COVID at the moment.
So COVID's all around us. Okay, in the respect that all over the world, people are getting COVID, but people are vaccinated. And it's very similar, as we predicted, to the seasonal influenzas, the seasonal flus. So if you're vaccinated and you've got a good immunity, then you'll be able to manage it. And yes, you will get sick and you'll get flu-like symptoms.
I was actually quite ill.
Okay, but you are in a different category of illness. Let's not jump to different conclusions. Yeah. So you'll get ill. You'll get a fever. You'll get flu. You'll get a sore body. You'll cough, etc. But if you're vaccinated, you'll be able to get through it relatively easy. The main variant that we're dealing with now is the XBB.1.5, which comes from the Northern Hemisphere, Southern Hemisphere, which we've heard a lot of people talking about, called the Kraken variant. Okay?
Yes, this Kraken thing.
Well, the funny thing is, the Kraken variant is descendant of the XBB, which is descendant of Griffin, which sounds like we're talking about Harry Potter. Okay,
rubbish.
So they've got all these funny names and funny things coming up in that, and it kind of takes away from the COVID, which is about time. Yeah. But the point of the matter is as follows: don't go mad about it. If you're over the age of 65, if you've got comorbidities, get your vaccine. Get your booster. There's going to be a yearly booster for COVID going forward for everybody. At the same way you have a flu vaccine, you're going to have a COVID vaccine. Eventually, they're going to make it a dual booster. So it'll have a COVID vaccine plus a flu vaccine. But the question which they're trying to work out and why it's taking so long is which variants do they put in? Do they put in part of the Omicron? Do they put in part of the novel virus that was the Wuhan virus that came with it initially? And they've got to work out which are the best sources. You want the Kraken. What about the Griffin? Sounds like you're Scottish with Kraken.
I want a Kraken.
You need a Kraken.
Yeah, that is, yeah. So if you're under 65.
So even though those over the age of 50, I would say still should have one if they've got comorbidities.
Okay, so not for me yet.
So not for you. What I do think is very interesting, and it came out this week, and I have to mention this because I think, all through the way we've said this, there was a study in JAMA, the Journal of American Medicine, which looked at a Cochrane meta-analysis that shows, and don't fall off your chair, at a higher dose and a duration, ivermectin is still not effective against COVID-19. Can you believe it?
Right.
I mean, so to all those anti-vaxxers,
I don't know
all
why you
those
didn't tell us.
ivermectiners,
I don't know why you didn't tell us. You should have just told us.
I should have. I know.
Okay, so if somebody does have COVID, are they masking? Are they staying home for 5 days? Are they isolating? What are they doing?
Okay, if you got COVID and it was picked up and you're asymptomatic, let's say you're going for an operation.
Okay.
You had a swab done for some reason and then you find you're asymptomatic. You don't have to isolate, but you should wear a mask when you go out with people for about 5 to 7 days, ideally 5 days. But just be careful when you're going out into crowds.
I judge people in masks.
Okay.
Though. I do judge people in masks.
I wear a mask at the hospital, but that's because I'm protecting myself from all other viruses.
That's kind of different then. Yeah.
But you are judgy. If you are symptomatic from moderate to severe, you need to isolate for 7 days. There's no such thing as quarantining anymore. They're only looking at things like quarantine if there's a cohort of people. In other words, there's 3 or 4 people in the same family that are all infected, then rather stay away from other people because it's much easier transmitting the virus.
Okay. So in other words, just don't be an idiot.
Yeah.
I think that seems to be the rule of COVID now. Just don't be an idiot.
Yeah.
And if you're friends with people who are running comrades,
don't hug them. Don't hug them. I mean, I love hugging people, but don't hug the comrades people.
Yeah, just keep away from comrades people. That's a general rule for now, even though it's still quite early in the year, but we know how these things go.
Yeah.
Okay, so COVID's done. We finished talking about COVID.
Dusted.
No, I can't. I can't not ask you this question. I'm sorry. Because since we stopped the COVID podcast, there are a lot of reports about people like dropping dead, 28-year-old dropping dead, and the anti-vaxxers, or many people, are suggesting that this is as a result of the vaccine.
Yeah.
Is there any truth in
There's
that?
no truth to it. I think what people misunderstand is that we have now become academic health gurus, all of us. So because of a pandemic and because of everyone's now academically inclined to research things more definitively than they used to before. So we've now taken on a whole different meaning to understanding things about our health. And what the general person in the street doesn't realize is that people died before COVID. And people of young age...
I've never heard of such a thing.
People of young age died as well. So
but
when someone who's 15 or 17 is dying, they're not dying because of a vaccine. They're dying because they've got an abnormal heart rhythm. Or they've got a genetic predisposition to an abnormality.
Did athletes
die
in the same numbers as they are dying now?
Yes. There's always been these post-viral infections and these post-viral inflammations of the heart and all these things. But we're more aware of it because of other reasons now.
Yeah, and athletes push themselves more.
Yeah.
Okay, very interesting. Now can we do away with COVID? Done. People died before COVID and they're going to die after COVID. But not, I heard, if they have ice baths. Because if you have ice baths, this is what I heard, you can live practically forever.
Yeah. They can live in Sweden or Norway.
No, is this not true? I'm looking at an article right here, ice bath benefit. This is the research.
I do believe that Captain America lived forever, but I don't think it was an ice bath. I think it was more like cryogenic freezing.
Relief sore muscles.
Okay, so...
dates back decades.
Let's talk about what ice baths are, okay? And another name for an ice bath is they call cold water immersion therapy. So
okay, that sounds
the jury's
medical.
out on exactly for how long and the exact degrees Celsius or Fahrenheit that you've got to be under for, but they say for about 5 to 10 minutes at about 10 to 15 degrees Celsius, okay, which is very cold, okay? And what does that do? That helps decrease muscle inflammation and it helps constrict your blood vessels so the blood doesn't flow to those certain areas that have been overworked. So it decreases muscle pain and it decreases muscle damage. The cold water itself also can help release endorphins, so it uplifts your mood.
So if I'm in a good mood and my muscles aren't sore, I'm wasting my time.
Literally, yeah.
Okay.
But you're never in a good mood, so you better ask it, baby. But the point of the matter is that there's no definitive proof to say that an ice bath compared to passive recovery is much better. So we know it does help acutely. I mean, if you've done a marathon or you've done a hard gym session, I'm talking about like elite ultra training, and you put ice on yourself, it's going to help because it helps relieve the pain. But it can also cause things like hypothermia, where you drop your degrees of your core body temperature, and you've got to condition yourself for it. And it can cause increased risk to people with heart problems and cardiovascular disease. So you've got to be very careful with it. So the jury's out on whether the risks, benefits outweigh the use of it or not. But I don't believe it's a terrible thing, but you've got to condition yourself. And I think it is a good thing, especially for people with, endurance training and that type of thing.
And what about having a ice cold shower? I mean, people are talking about the benefits of this sort of thing as though it's really something.
So there's a lot of talk about that with weight loss, that you have an ice cold shower like
Really?
straight after you think, because once again it constricts your blood vessels, so then you don't get the blood flow to your stomach, you don't get the blood flow to certain areas, and it channels it away from those areas which you would normally have to use afterwards.
Interesting.
But the thing to worry about, and a lot of athletes do that, and it's very dangerous, is that if you're going to go from a hot environment to a freezing cold environment, so let's say you go into a sauna.
Yeah, I wanted to ask you about sauna.
A sauna where you've probably got a relative heat of about 70 to 100 degrees, and it's a dry heat, and then you go jump in an ice cold pool. That can precipitate a cardiac event because it's completely opposite to the ice bath. You are dilating your blood vessels, so you're causing them to enlarge and you're improving your circulation to that area, which also helps with the reduction of stress levels, and it also helps you make you euphoric, but it can stimulate cardiac problems as well.
So all of these things, it's like cups of coffee.
So yeah, so
Just moderation.
one of the things I've read before is that there's no benefit to having one sauna a week. Rather, have 3 to 5 saunas to help improve your quality of life. But first of all, you've got to have time for it, and second of all, the other issues with these things. There's fungi, which are certain funguses that sit in these saunas, and you get a fungal infection of your lungs. So everything in moderation. I think that's the key to thing. Moderation won't kill you. Right. Excessiveness will kill you.
Okay, that's interesting. The other subject that I actually wanted to talk to you about was lots and lots and lots of talk about Ozempic.
Oh boy.
Why? Is it a controversial subject?
No, it's not a controversial subject, but I think the matter is
all right, we can move on to something else.
I think that in certain communities it gets overdone. And the big problem with Ozempic is it's been out of stock for a while because it's been overused. In other words, it's made for a certain type of person, and a person is somebody that is diabetic, okay? And it works, it's a substance called semaglutide. So it works by binding to the GLP receptors. A GLP receptor is a glucagon-like peptide receptor, which stimulates insulin release from your pancreas. So when you have sugar in your food or carbohydrates, it mimics the action of this GLP receptor, and it stimulates your blood glucose to drop. In other words, you don't release the glucose from your liver. Therefore, it helps by slowing down your metabolism, and the food leaving your stomach doesn't leave as quickly. It stays there for a longer period of time, and it doesn't cause your sugar to spike. And that's the ideal thing. It was made as a diabetic drug, but similar to a thing like Viagra, which was made as a blood pressure tablet and then works on erectile dysfunction, here you've got an injection which is taken once a week, which helps with weight loss. And it definitely works. There's no doubt about it.
Are you seeing results of your patients?
So I think we've got to take it back one step and say, who should be using Ozempic? Should someone with a BMI of 18 to 24 be using Ozempic? What's a BMI? It's your body mass index. You work it out by taking your weight in kilograms divided by your height squared. And if you've got a BMI of 18 to 24, which is normal weight, no, you shouldn't be using Ozempic. If you've got a BMI of 25 to 29, where you're considered overweight, nope, you shouldn't be using Ozempic.
What?
But if you're obese, if you've got a BMI greater than 30,
so you would recommend it
there's
to
a role
only
for
obese
using
people?
Ozempic, but not in isolation. In other words, with a controlled diet, with exercise.
And coffee.
The biggest problem is, once again, no good deed goes unpunished. So all medication have got side effects. The first thing is that as soon as you stop using it, that society of yours that is stopped comes back in a big way. So you're going to want to eat. So it's not like your stomach shrinks and then you won't eat again. You will eat. And that's a problem. The other thing is, if you've got things like pancreas problems or liver problems, you're supposed to avoid it because it can cause a pancreatitis. And there's been also a link with thyroid cancers, with medullary cancer of the thyroid. So you've got to be very careful.
So it's not without its risks.
It's not without risk, and it's got to be done with a medical practitioner advising you how to take it and how to use it. Not just, my favorite saying, willy-nilly, that someone wants to lose a few kilograms and use all the stock, so there's nothing available for our diabetic patients. Okay. There's also other things. I mean, some pregnant people and some breastfeeding people want to use it, and it's not safe. There's no evidence to show it's safe to be used in breastfeeding or pregnancy.
So it works, are you saying it really works in two different ways?
Yes, I'm saying it plays a role in digestion and appetite suppression, as well as it plays a role in lowering your sugar. So you don't have sugar
Right,
spikes and it decreases
okay.
your sugar levels.
If somebody's pre-diabetic, then I would imagine it's actually quite helpful,
Yes,
right?
and there are lots of drugs on the market there. There's things called Byetta, Victoza, Saxenda, all other things that are available for that type of thing.
Saxenda, that's another weight loss one,
Saxenda is
no?
very similar to Ozempic, except Saxenda, unlike Ozempic, is a daily injection.
Okay, so
Ozempic
quite-
is a weekly injection, and you start at an incremental dose and use upwards. One of the major problems with Ozempic also is that for the first 2 weeks, people suffer from severe diarrhea. And it's not an easy diarrhea just to settle
Right.
down with, because it really does the
And
job.
Saxenda, is there a similar types?
The Saxenda, the diarrhea isn't as bad, but you still can get
How does
diarrhea
it
with
compare to something like glucophage that people...
So glucophage is not a weight loss drug, first of all.
Okay.
Glucophage is an extremely overprescribed drug that gets used for a different
weight loss.
sort of, well, for weight loss it's overprescribed, you know.
are people using it for...
People use it for, unfortunately, some
okay,
people use it for
okay.
weight loss. It's not targeted for weight loss. It's for people with insulin resistance and people with diabetes. It's a very good drug. It sensitizes the pancreas to insulin. It's a very, very good drug. You can't use it if you've got kidney failure or things like that. But it's not a weight loss drug. And let me repeat that. It's not a weight loss drug. It's used in other conditions like polycystic ovarian syndrome, with people who get develop facial hair, with females who have problems with that, and it's very good for that. But it's not a weight loss drug.
Okay. So Ozempic, just because that was what we were focusing on, is a very effective drug for weight loss. You are seeing good
We're
results.
seeing very good results.
Really?
But also, the point is that we're seeing results while the people are on it. Once they're off it,
Right, I get that.
we're not.
I
And it's expensive.
understand
It's
all of
another
that.
thing is it's expensive. You're looking at about 3,000 to 4,000 rand a month. It's not going to be paid for by medical aid for a weight loss program.
Oh, it won't be.
No.
And it's only on, you can only get it with a script.
You can only get it with a script.
But you're strongly advising people, if you are going to want to go on this, go to see a doctor.
You have to see
make sure that
a
you're doing
doctor
this
that
properly.
understands what it's about and how to do
it.
it properly.
Okay. The other thing that I wanted to ask you about as well is there's definitely a lot of misery around, anxiety around. Yes, there's load shedding stage 6 in South Africa. If you're watching in, if listeners people are watching in South Africa, and that has a big impact. In Europe, there's concerns around energy prices and winter, the ability to be able to sustain a lifestyle. Israel's having a lot of concerns. America, I mean, they're always on the brink of something. And Barney's coming back in America, which is obviously a tragic story for Americans. But are you seeing in your practice more anxiety, depression around than you've seen?
Mental shutdown. People are going mad. People are acting differently. People are acting strangely. And I think it's got a lot to do with post-COVID. Sorry, we have to bring the COVID thing back again.
No, well, it's a reality of
But-
our world, yeah.
COVID, in some weird and, I don't know, wonderful way, gave us structure. The structure gave us was we had rules. We had a path to follow.
And we like rules.
Don't do this. Don't do that.
Yeah.
Go out here. Wear a mask here. Don't gather together. You can't go out. You can go out. Now, all of a sudden, we're being let to run loose and wild again. And we don't have a set of rules to follow anymore. So we're not sure which way to go. Now, all of a sudden, people are dealing with financial insecurity.
There's a lot of that around.
There's stress. There's anxiety from this. We're dealing with the mop-up of the emotional fallout from all our children at school, from parents not knowing, where to go and how to deal with their children, not knowing how to deal with their relationships with each other, with other people, and people not being able to cohabit with other people. You've had elderly people that have been isolated for 2 to 3 years that are now only starting to come back into society and having to deal with people again and having to share society with other people.
Yeah, I think that's very true. Even of people like myself who are extroverts, I find spending a lot of time with people quite tiring. I don't have the same social fitness.
You've got social fatigue.
I just don't have that fitness that I used to have. It's an interesting thing. And
So now you're an athlete.
You know, no one's ever called me that before, and I want to thank you.
And then
for
you
that.
don't need Ozempic.
It was going to be after the podcast. We were going to talk about that. What is wrong with you? How well do you know me? And that's doctor-patient confidentiality.
100%.
Anyway,
I would never mention
blown
on
right
radio.
there. No. Anyway, so yeah, it's difficult. It's difficult, even for those of us who are comfortable socially, to sustain the same levels.
Yeah. It's basically we've now got our training wheels back on our bikes.
Yeah.
And we by
Or off
no
our
means
bikes.
on our bikes, because we're by no means ready to ride without them yet.
Right.
We've got those
Okay, I
fairy
see what
wheels.
you're saying.
You know, we can't ride without them. We need help at the moment. Everybody's needing some sort of help, and we've got to use the help around us. We've got to actually start employing people around us to work together to bring us back to a pre-COVID reality or pre-COVID existence.
Although that said, I think there's a lot more honesty out there emotionally, and I think that's a good thing.
For now, you know, things go through trends.
Yeah.
So for now, when there's a slump, the honesty is there. But then, like any phenomenon,
Yeah, we go back
things go
behind
backwards.
our facade. That is very, very interesting. That brings us to a close of our first Will It Kill Me podcast. So what we're going to do is each one of these episodes, we're going to take a look at medical trends. Some weeks we'll focus on something much more in depth, as if there's a breakthrough in something medical, if we decide to go into in-depth into a medical condition. And we'd love to hear from you. The first thing you need to do is subscribe below, because you haven't done that. So go ahead and do that. Do it now while we wait. And then send us your questions. Let us know some of the subjects that you would like us to talk about. You've got this facility. It's free. It's free. Yeah, medical advice. I mean, a lot of it's going to be about me, but you're going to have to just endure that. Maybe that's the price you're going to pay. Either way.
So can I interject there? What's this podcast called?
Is this going to kill me?
I mean, that comes from a hypochondriac. I mean, how
Well, it's a hypochondriac
insane
perspective.
can you make that in thing? And why just write the Howard Feldman podcast rather?
Do you want to do that? We
Oh,
can.
Wouldn't that be ideal?
Right. I'm Howard Feldman. Is it going to kill me? Join us next week with Anton Meyberg.
Is This Going to Kill Me? A health podcast with Howard Feldman and Dr. Anton Meyberg.